into your nasal cavity here. Now, our next bone is the ethmoid. And the ethmoid, let's find a better view of that. You can see it best internally. So a couple of things here. It is behind the eye. It also makes up part of the nasal septum. And it has these little structures here, which actually act as turbinates. They're called concha because they're shaped like conch shells, but they spin the air as we breathe in and help warm it. And if we go to a slightly different view, from the anterior, you can see the ethmoid bone is sort of like this. Actually, if it were disarticulated, it would look a lot like a walnut. And from the best viewpoint, we're going to go back here. And you can see part of it here. And the two structures that I want you to know about the ethmoid are this little fin right here, and that is called the cristogalli. And then on either side of that are grooves. And in those grooves is where your olfactory nerve sits. Olfactory is your sense of smell. And there are little tiny pinholes located all through here that are called, that structure with the pinholes and that little flat groove, that is your cribriform plate. Now, those little holes allow processes from those olfactory nerves to go to receptors in the nasal cavity, and can't really find a good angle here. But basically, receptors that are right up in here that allow us to smell. So, we've got the cristogalli and the cribriform plate. Our next bone, and this one is a little hard to see, frankly, on any of these. You're not going to really see this in life, but it does make up a portion, nasal septum. So if we're looking here, this is the ethmoid bone, and this is the vomer. Okay, so it's a little posterior portion here. And if you have a deviated septum, you're usually talking about something happening either with the ethmoid bone or with the vomer. The palatine bone, and you think of the palate as being the roof of your mouth, and actually the roof of your mouth largely is the maxilla. This portion right here is the palatine bone. Let's see if we can find just a slightly better view here. I'm going to rotate this guy. And the palatine bone is this blue portion here. Now, our next bone is the sphenoid bone. And it's called the sphenoid bone because it's shaped like a bat, they say. The yellow portion here is the sphenoid. And let's take a different view of it. So they're saying that this is bat-shaped. Now, there's lots of different structures here. We actually have two openings here where we have the optic nerve come in. We have a portion of it here, which is the superior orbital fissure. So, but we don't need to know all of those. What we want to know is that these little fins sticking out here and this portion here ending right here, that's called the sella turcica or Turkish saddle. And let's see if I can move in. So you get the idea. Right in here is where the pituitary gland would actually sit. And we've got these fins, and we've got this portion toward the posterior. Now let me back out a little bit. And again, those fins, this portion here, and the pituitary sits here. Now, the pituitary actually, this is where the optic nerve comes in, and they cross right here and form something called the optic chiasm. And people may have a pituitary gland tumor, and you don't really realize it until it starts to compress one of those optic nerves, and a person may end up going blind. So, that's the sella turcica right there. The next bone, also part of the skull, but it is the only movable bone in the skull, is the mandible. And let's take a look here. The mandible is this guy here. We have muscles that attach here, and this is called the coronoid process. And that muscle comes up and fans out along here. And then there is another muscle that attaches here and to the underside of the zygomatic arch. And it's those two muscles that allow us to chew. Now, this is mandibular condyle. Again, the mandible largely is here to hold teeth, but if you lose teeth, this will dissolve away as well. Unfortunate aspect of that is right here. This little structure is called the mental foramen, and we have a nerve that comes out here. That nerve actually is part of the trigeminal nerve, and it enters here. And what can happen is, over time, that bone can dissolve away. That can roll up kind of over onto the top surface of the mandible. And then someone who has a denture, they're actually zinging that kind of every time they bite. So imagine hitting your funny bone every time you took a bite, and you get a sense of what they feel. Also, that makes the bone, as it dissolves, it can get progressively thinner. I have stepped on a rake before, smacked myself in the face, and became reacquainted with all of the different profanities that I was aware of. But I didn't break anything. But someone who's older, who lost their teeth when they were young, this bone can get really thin. And I have seen people with this mandible broken by doing something as silly as stepping on a rake. We have literally finished all of the bones of the skull. The next bone we're looking at is this hyoid bone here. It's this little horseshoe-shaped bone. And as I said earlier, it is what supports the tongue. Now, I'm going to stop right here and proceed with the rest of the axial skeleton on a different video.